This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hello, everyone, and welcome back to the Outcomes Rocket. I'm excited to be sharing another interview that we did on the show floor of HFMA National at the Denver Convention Center. It was a phenomenal opportunity to meet with Jason Rose, the CEO of Clearsense, and Kevin Erdal. He's the Senior Vice President at Nordic Consulting Partners. In the interview, we discussed a lot of interesting things, specifically around taking cost out of health systems with old applications. Jason and Kevin call them zombie apps. There's also duplicate apps, and many of them are literally costing 7 to 8 figures annually to health systems, and they're actually speeding up the process, getting rid of them. They talked to us all about that and some of the issues on CFOs' minds, all from the show floor. So I'm excited to get into it here. First off, we just want to welcome both of you to the podcast and tell us a little bit about who you are and what your organizations do.
Hey, everyone. I'm Jason Rose. I'm the CEO of Clearsense, and I'm here with Kevin Erdal from Nordic Global to talk about our new partnership between Nordic and Clearsense.
Absolutely. Kevin Erdal, I lead up our advisory practice at Nordic. Been around for about 6 years and really excited to do some strategic initiatives with our friends at Clearsense.
What's one insight you've gained from HFMA this year that folks who couldn't attend should know about?
This is the first time that Clearsense has actually joined HFMA, and I'm struck by the amount of interest in hard cost takeout because of all the Medicaid funding issues, some of the cost increases that are occurring within the economy. And I'm struck by the health systems, their urgent need to find bona fide cost savings that can really drive operational cost savings permanently. And I'm seeing that. Have you seen some
Absolutely.
Things, Kevin?
Yeah, I'll just reflect on the session I was on this morning. And it was a chief revenue officer that made the declarative statement where their CFO said, don't bring anything forward if there isn't an immediate ROI that we can measure within the year, for example. So I think the cost takeout, cost savings message is very, very prevalent, if you will, across not only the floor, but also the sessions folks are talking about.
How are your organizations helping finance leaders take meaningful costs out of the system, and what are some practical approaches they should consider?
I couldn't be more excited about our partnership with Nordic. It's been a fantastic relationship already. We just formally announced it today. We are also excited that we can help immediately with these health systems and taking hard cost takeout. And the main area that we focus on is what's called active archiving. And if you think about typical health systems, they're bloated with their application portfolios. Gartner says it's 20 to 30% of absolute waste and with respect to how many applications are redundant or even what they call zombies within the health system. And we're pleased as a SaaS organization to help archive the applications and then working with Nordic to drive your areas. You want to talk about that, Kevin?
Yeah, absolutely. So identifying some of those zombie applications is oftentimes a bit of an art and science all at the same time. So that's where our partnership has been really fruitful. It makes a lot of sense, not only for us, but our customers. And just as an example, we're working with a large organization right now that has 2,200 applications within their entire portfolio. We immediately found 44 that fall into that zombie app category, if you will, which equates to about a $27 million of cost takeout.
$27 million.
27 that we can take out over about a 3-year span, but those opportunities are immediately available and we don't have to bring in net new costs to be able to do that effort.
Yeah, and so let's talk about what is a zombie app, because I get a lot of questions on that. So a zombie app is where you have an application within the portfolio that is unnecessary and it's costly and it's actually lethal. And why is it lethal? Because it's got the most amount of cyber risk probably within your entire stack. It's probably not being maintained properly, probably doesn't have all the patches and updates, and it's just not being used. So it's not quite dead, but it's there and it's actively running, but it's also lethal. And so it really needs to be killed. And so we are as Nordic and Clearsense, we're looking to find those heroes within health systems. They could be the CEO to CFO to COO to CIO, and find ways to take out these zombie apps and then drive additional areas of cost reduction. That's really our first phase. And so, Kevin, what do we do in the next phase after we kill the zombies?
Yeah, the next phase is really that continuous improvement, and we start looking at some of those redundant applications as well. We've already identified with some of our existing customers scenarios where they have an application running that they're, I would say, passively using. It may not be a zombie even, but 4 or 5 users are using that particular application because they didn't even know there was an alternative opportunity. So what we do then is, by supporting change management, being able to do some of the training, transition them from existing application to an enterprise standard, not only to help with continuity, but also to help reduce the cybersecurity footprint, if you will, overall vulnerability, and ultimately save some of that cost. And to do that, to comply with the data retention policies that most organizations have, which is keep your data as long as you possibly can. We need to archive that legacy data and then provide pathways not only to it from an analytics or from an AI perspective, but also business operations is critically important as well.
And you still got to keep the data accessible.
Yep.
So some of the applications can go into what's called cold storage, and it's more of a ask when you need the data. But much of the data is more hot or warm data, which is where it's just accessible. If I'm a clinician, I'm inside of Epic, it's at the point of care. I want to see the longitudinal electronic medical record, and I launch within Epic, not knowing to the user, they're launching a new system without any new user credentials, and they see the last 20 years, 15 years of clinical data that help them provide better care.
Yeah, that point of care piece is critical and making it easy, right? So that's where, I've gotten very excited as we've talked for the last now almost year at this point, as we've been establishing our partnership. It can't be a net new application, a net new workflow, because as we're doing the training with the clinician in particular, we can't say, just jump into another application.
Back and forth.
That doesn't work.
Do that.
And it shouldn't be that way, right? So let's make it easy. Let's make it simple. And that's where I think their continuity will really be beneficial long-term.
Yeah. And so this is one of the most purest, if not the purest way to identify cost takeout. And so we see a lot of opportunity within the organizations, but I guess the issue that I'm seeing also, another area of topic that I've seen within these health systems is like, well, no, we already have archiving.
Yeah.
We already do this. We already did this years ago. And what they haven't done is they've done this tactical, they did a merger acquisition, they rolled out Epic or Workday, but they haven't looked at the entire inventory, the entire application portfolio, and said, what can I do to manage it better? And looking at holistically, strategically, and really becomes strategically a mandate from frankly, the CEO on down. That's why we're here at HFMA to talk to the CFOs, to make sure there's awareness that you can actually cut so much cost out strategically, and really starting with Nordic's assessment that they do with respect to the rough order of magnitude. Do you want to talk about that, Kevin?
Yeah, within 4 to 6 weeks, right? We can come in and be able to find that initial opportunity and say, what kind of dollars are we talking about? I'm often surprised, not so much anymore because I've been doing this a while, about the lack of application inventory that a lot of our customers have. And it's not by any reason other than there's many other strategic priorities that have been going on. And what ends up happening is net new applications come in to solve novel, clinical, relevant problems. And that's amazing. And we see that all the time. Net new AI software or new software that is a new entrant to the market, which is exciting. And our customers get excited about it. But what doesn't happen is, well, what are we replacing? And so by establishing a proper governance and overall program management around the entire application portfolio, we can not only manage existing applications, but as net new things come in, we can support that analysis and surface the right questions to governance, if you will, to say, okay, we're bringing in a new application. What are the 2 applications we can maybe sunset? Maybe it's not this year, but we can do it next year. Or best case scenario, we can do it almost immediately. So that governance and that overall discipline, if you will, for application analysis coming in is almost equally as important as we get through the collective program or the project itself.
Yeah. And so what we're really building is this momentum and this awareness of this massive cost takeout. This is software licenses, infrastructure costs, and personnel, and both reducing costs, also funding innovation, because you now have all this digital that wasn't available prior. Now it's patient matched and available in the consciousness. But over a multi-year program, typically, you're going to look at a prioritization of building a supply chain. And it's a supply chain of applications that are Year one, you're doing zombie apps, you're doing the redundancy apps.
Yep.
Year two, or maybe, within year one at the end, you're now focusing on the more consolidation, and maybe the software license wasn't cancelable until year two or year three. So you're building out this multi-year discipline, full alignment, transparency, scorecards within the C-suite of the health system. And you've got this long-term cost takeout. It becomes really an apparatus within the health system that helps them drive innovation, cost takeout, profitability, all those types of things.
Yeah, and I'll just double down on the innovation aspect. And we hear a fair bit of that around this conference already too. And that people will say, well, that sounds very exciting. How do I fund that? Well, this is one opportunity to say, if we can take out $2 million of costs in year one, that becomes your innovation fund for the next year. So it's just another mechanism to be able to use some existing dollars, if you will, for not just next year, but years to come. And that's where that discipline within the collective program becomes paramount.
Well, I really want to thank you both, Jason and Kevin, for spending time with us. What advice would you give VPs of finance, CIOs, COOs, CEOs who are leaving this meeting and thinking about application archiving, but also for those that couldn't make it, that should walk away with a great way to get a win for their organization?
Coming out of this meeting, what I would recommend, if you're thinking about a merger or an acquisition, or you're doing any consolidation, you're rolling out Epic, or you're rolling out a Workday or any other consolidation, I would really strongly consider application archiving as part of the investment thesis. And the reason why is that you can actually treat the implementation of each individual application as a capital budget expense that drives down immediate and ongoing and permanent OpEx changes. Typically, within mergers, acquisitions, for example, the CFOs and the corporate development aren't thinking about this. This is an afterthought. Numbers are immensely large, not to mention the TSA costs as well. Those things should not be afterthoughts. They should be right in the investment thesis of whatever merger, acquisition, or application rollout you're having. And also, I would say is reach out to Nordic, Kevin, myself, within our organizations. You can go to either of our websites, obviously, as well, and talk to us about this assessment that we could do out of the box that would be minimal amount of effort and very quick in terms of rough order of magnitude.
Exactly. And I would also add, don't assume that you're done. Say you did an M&A 2 years ago, or you were acquired 3 years ago, and you feel like you've done some archiving over the last 5 or 6 years. We've worked with some customers where that's been the case, and there's still a tremendous amount of opportunity. One thing that I get excited about, and Jason knows as well, is the scale and velocity in which we can archive applications together. So once we identify those opportunities, if maybe you're archiving 5 or 6 applications in a year, we might be able to do 10 or 15 with the proper technology, the proper governance, so we can accelerate some of what's already been started within organizations as well. So, and like Jason said, it's available on our websites, all the socials, pretty easy to get in contact.
Yeah, and the last thing is that, last week, Class Research just published a white paper, a case study on Clearsense about exactly the types of things that we're talking about here. This is reportedly the largest archiving program in the history of U.S. healthcare. So we've saved nearly $70 million of OpEx cost savings, archiving about 800 applications so far, on our way to over $100 million of permanent operational cost takeout with a very large national health system. And so this is a radically different, very accelerated, larger program that we're used to. So it's not transactional, very strategic. And I encourage CFOs, heads of finance, to talk with their CIOs or chief digital, their CEOs and their entire leadership team about whether it makes sense to just get a quick assessment and see what the cost takeout is. Because I can promise you, you're not a unicorn. And you're not one of the small health systems out there in the world that happen to not be a 20, 30% bloating this, like Gartner says. You're probably right there, despite what you might think. It's worth taking a look at. And it's a minimal cost and very minimal effort.
Absolutely. Couldn't agree more.
All right. Well, there you have it, folks. Such an incredible opportunity to connect with Jason Rose, CEO at Clearsense, and Kevin Erdal, Senior Vice President at Nordic Consulting Partners. Just an extraordinary partnership that they have going to help large health systems do more with the data that they have and take it to the next level by archiving some of these applications, these zombie applications, getting rid of them and saving folks 7 to 8 figures on an annual basis. Just an impressive partnership there. In the links, you'll find ways to get in touch with both of them and their organizations so that you too could take advantage of these innovative approaches to technology. Thank you all for tuning in, and we'll catch you next time on this HFMA Insight series. This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.